Most babies light up when they see their parents. They cry to be held, they calm when cuddled, and they reach out when they're feeling scared. But what happens when that bond, the one that's supposed to feel safe, never forms? Some children don't seek comfort. Others are too comfortable with strangers. This isn't just a personality quirk in some kids, it may be a sign of an attachment disorder. And early recognition can change the trajectory of a child's life. I'm Dr. Larry Mitnaul, a double board certified child and adolescent psychiatrist. I'm also a father of 7, and I love talking about attachment in the age of screens. Let's talk about what are attachment disorders. Attachment is the emotional glue between a child and their caregiver, and it forms when babies consistently feel seen, soothed, and safe. But when that connection is broken by trauma, neglect, or frequent caregiver changes, it can leave a lasting imprint on a child's brain and behavior. Attachment disorders are psychiatric conditions that disrupt a child's ability to form healthy relationships. They often show up before age 5, and earlier they're identified, the better we are at helping them address it. So, what are the signs and symptoms that something's not right? Well, parents can notice a host of things in infancy and toddlerhood that may be signals of this. Severe colic or feeding struggles. Maybe children are having difficulty gaining weight. They can be detached or unresponsive in their behavior. Maybe they're not seeking comfort when they're feeling upset. They can also push caregivers away and act really oddly defiant. Some kiddos express this as being extremely hesitant, while others may exhibit extremely clingy behaviors with strangers. So, in short, the child doesn't relate to people the way you'd expect. And these patterns aren't just emotional, they can shape how a child learns, how they trust, and how they interact with the world long term. So, broadly speaking, we think about 2 types of attachment disorders. There's reactive attachment disorder, or RAD, and children with RAD often seem disconnected from their caregivers. They might not even look for comfort. They struggle to calm down when they're feeling upset. They might appear sad, scared, or irritable, even during normal play. Now, these children aren't cold. They've simply learned the world isn't safe and that trusting others gets them hurt or ignored. There's also something called Disinhibited Social Engagement Disorder, DSED. And this is the opposite extreme. So kids with DSED don't show typical caution with strangers. They'll hug unfamiliar adults, go off without checking in, and seem overly familiar even in unsafe conditions. They crave connection, but without the instinct to actually protect themselves. What causes attachment disorders? Attachment disorders typically stem from early relational trauma, and that might include severe neglect or emotional deprivation, abuse or inconsistent caregiving, and institutional care. So think orphanages or frequent changes in caregivers or foster placements. What's important to remember is this: children aren't born with these disorders, they develop them when their earliest needs aren't met. What do you do if you're concerned? If you see these signs in your child or a child you care for, it's important to seek a comprehensive psychiatric evaluation from a qualified professional, preferably a child and adolescent psychiatrist. I'm going to want you to avoid harmful or pseudoscientific treatments like rebirthing or coercive bonding techniques. These really are not evidence-based and can actually be dangerous. I want you to ask questions and maybe get a second opinion if needed. You deserve to fully understand the diagnosis and what the treatment options would be. So, what does treatment look like? Treatment really focuses on healing the bond between child and caregiver. And so that might look like, and you may have heard these terms before, attachment focused family therapy, trauma informed behavioral therapy, parenting support and education, coordination with schools and other caregivers. And so, as you're hearing, this isn't a quick fix, but with patience, with consistency, and professional guidance, healing is possible. Some things to consider. Parents, having a child with RAD or DSED is difficult and really hard. You may feel rejected, blamed, or even lost, but your consistent, compassionate presence does make a difference, even if your child can't show it right now. Your job is not to fix the past. Your job is to help your child build trust in the present, one safe moment at a time. Attachment disorders are serious, but they're not hopeless. With early diagnosis, trauma-informed care, and a strong treatment team, children can learn to connect and thrive. So speaking of connection, watch this next video on strengthening your connection with your child, and check out the description link and top comment if you're looking for free resources to take you and your parenting to the next level. You're not alone. Healing begins with understanding, and you're already taking the first step. Take good care, my friends. Be well.